Hello, and welcome to the Benefits and Entitlement webinar, an overview for members and families. Here to present for us today is our wonderful Assistant Director of Eligibility, Joseph Lack. Joe, the floor is yours.
Thank you, Brianna. Hello, families and members. We're here to talk about Medicaid-related things, so let's get into it. Next slide, please. All right, so today we have a couple different topics we're going to talk about. First, we're going to talk about general Medicaid information. We're going to talk about income and resource requirements. We're going to talk about Medicaid managed care. We're going to talk about Social Security and Medicaid, some special Medicaid programs, a little overview on Medicare, and COVID-19 Medicaid program modifications. Next slide, please. All right, so let's start off with just some Medicaid definitions. So what is Medicaid? Well, Medicaid is a government-funded health insurance program for people who qualify based on income and resource standards. Now, what are income and what is resources? Income, that's money earned through work or received from programs such as Social Security, temporary assistance, an unemployment benefit, child support, alimony, dividends, and pensions are other sources of countable income. And then resources. What are resources? Well, they're financial assets such as bank accounts, retirement accounts, stocks, bonds, mutual funds, life insurance, burial accounts, trust accounts, vehicles, homes, and 529A accounts. Next slide, please. So what does Medicaid cover? Medicaid covers your healthcare services. That would be your medical, dental, and vision. It also covers your prescribed medications and other durable medical equipment. It covers clinical services and different therapies. It also covers and offers home care, such as the CDPAP program, home health aides, and other programs like that, and medical transportation to medical appointments. Next slide, please. What does Medicaid cover? In addition to your medical services, it also covers disability-related services and programs. That would be your OPWDD care management and HCBS waiver services, Department of Health Children's HCBS waiver services, traumatic brain injury waiver, nursing home transition, and diversion waiver. And Medicaid is always the payer of last resort. Next slide, please. Medicaid for OPWDD services. If OPWDD services are needed, the Medicaid case must be through your local Medicaid district. For New York City, that's HRA, the Human Resource Administration, and that covers all of the 5 boroughs here in New York City. And if you're outside of New York City, you use your local Department of Social Services, also known as DSS, and those locations may vary based on your town of residence. It's important to know you should not have Medicaid through the New York State marketplace. That's also known as the exchange or Obamacare. Your Medicaid case should not be coming from the New York State marketplace if you want to receive OPWDD services. The marketplace is also called the New York State of Health. Marketplace Medicaid does not cover OPWDD services. It also does not cover most types of home care services like CDPAS, CDPAP. Next slide, please. So the income and resource requirements, which are anticipated for 2023, is that monthly income limit for an individual will be $1,563, and for couples, $2,106. And then your total resource limit will be $28,134 for non-SSI cases, and for couples, that will be $37,908. And for SSI and DAC cases, that will be $2,000 resource limit. Next slide, please. Income and resource requirements. So our individuals can receive Medicaid with a spend down if they're over those income limits. There are some accounts that can help deal with spend downs, such as burial funds, pre-needs funeral agreements, special needs trusts, and New York ABLE accounts are examples of accounts that do not count toward the limit. Like I was saying, these accounts can bring down your resources if you are over the limit. Next slide, please. Medicaid and managed care. It is possible to have certain types of managed care plans. Mainstream Medicaid managed care health plans are contracted with commercial insurance providers. They're similar to preferred provider organizations, PPO plans. You must use in-network providers, and they're available if Medicaid is the only source of health insurance. Plan can be selected on the Medicaid application signature page. New York Medicaid Choice, also known as Maximus, enrolls people into managed care plans, and their contact number is 1-800-505-5678. These Medicaid managed care plans that are mainstream are compatible with care management and HCBS waiver services. And this is not to be confused with managed long-term care plans. These specifically are mainstream Medicaid managed care health plans. Next slide, please. This slide here on Medicaid managed care plans discusses the plans that are not compatible with CCO or HCBS waiver services. Those are MLTC plans, managed long-term care plans. For people with more complex medical needs, they might choose one of these plans. HARP, health and recovery plans, and these are for people with significant mental health or substance abuse needs. And SNP, special needs plans, for people with Medicare and Medicaid who meet Medicare requirements for severe or disabling chronic conditions. It's important to note, once again, that this slide is for plans that do not cover your CCO or HCBS waiver services. Next slide, please. The FIDA IDD, Fully Integrated Duals Advantage Intellectual and Developmental Disabilities Plan, covers your waiver services but does not cover CCO services. If this plan is wanted by any of the family members that are out there or any members, they would need to disenroll from our CCO. FIDA IDD plans must have Medicaid and Medicare. Care coordination is provided by Partners Health Plan, and they're geared towards people with more complex medical needs. Next slide, please. All right, so we're going to talk about Social Security and Medicaid. SSP is New York State Supplemental Program, the New York State program that provides cash assistance to SSI recipients and or individuals residing in congregate care. Benefit amount is based off living situation in the community versus OPWDD certified residents. Next slide, please. SSI, Supplemental Security Income, is a needs-based disability program that provides cash assistance to people who are disabled, over 65, or blind. In addition to qualifying from a medical standpoint, you must also qualify from an income and resource standpoint as well. Benefits amounts is based on living situation and contributions to household expenses. Examples of this, a loan in the community with family OPWDD certified residents. Will receive maximum benefits if contributing fair share to household expenses. SSI and SSP recipients are automatically enrolled in Medicaid, and as long as SSI remains intact, Medicaid remains active as well, and there's no need to recertify for someone who's receiving SSI. So if you are an SSI recipient, you do not get an annual recertification. Next slide, please. Supplemental Security Income, SSI. There is a cap to this benefit. 2023's federal benefit rates for an individual are $914, and for couples are $1,371. The 2023 resource limit for individuals remains at $2,000 and couples $3,000. Next slide, please. SSDI, not to be confused with SSI, SSDI is Social Security disability insurance. And this is a federal benefit based on work history. Must meet Social Security definition of disabled to qualify. Many people who were disabled before the age of 22 can receive SSDI as a disabled adult child, also known as the DAC, after their parents' retirement, disability, or death. The benefit is paid off parents' record, and the amount is based on parents' earnings. Some people may receive SSDI off their own work record, but must meet work credit requirements, and that varies depending on age. Benefit amount is based off lifetime earnings of primary beneficiary. Primary beneficiary, aka number holder, is the parent for someone who is a disabled adult child, DAC. SSDI recipients must apply for Medicaid separately from Social Security, so it's important to make sure that if you're receiving SSDI, that you will get an annual recertification in the mail. SSDI recipients become eligible for Medicare after 24 months waiting period. Next slide, please. Special Medicaid programs. The Medicare Savings Program assists with paying Medicare premiums, deductions, and coinsurance to qualifying Medicaid recipients. The anticipation in 2023 is that qualified Medicaid beneficiaries, QMBs, pays Part B premium to Medicare. That gross income is under $1,563 a month. And QI, qualified individuals, their gross income is under $2,107 a month. Next slide, please. Special Medicaid programs. Medicaid buy-in for working people with disabilities, also known as MBI, or also known as the MBI WPV program. It allows for a higher income and resource limit for disabled people who work or otherwise qualify for Medicaid. The income limit is for 2022 is $68,988 per year pre-tax, and the resource limit for 2022 is $20,000. And the person would only have to work as little as 1 hour per month to qualify for this program. And there is a 6-month grace period if you lose your job, receive unemployment benefits, and actively are looking for work. This is an amazing program for our individuals. If they're working or any of your family members are working, this is something that will help them keep their benefits and also give them the opportunity to work more and become more independent in the community. Next slide, please. Special Medicaid programs. Excess Income Program, also known as Spend Down Program, or also known as Surplus Program. Officially, the Excess Income Program. If your income is over the Medicaid income limit and you do not work, you can still have Medicaid by paying a spend down or surplus every month. What is countable income? Which is pre-tax income minus certain allowances, deductions from Medicaid. What are spend downs? Spend down, the difference between countable income and Medicaid income limit. Spend down / surpluses must be paid every month to have active coverage for services. Payments can be made for up to 6 months at a time. Payments can take 2 to 3 weeks to process, and payment is made to Medicaid office or to a special needs trust if applicable. Submit proof of out-of-pocket medical expenses to Medicaid in place of checks or cash payments. Will pay medical expenses, can give as much as 6 months of future coverages. Next slide, please. Special Medicaid programs. The Section 1619 benefit for the Social Security Act of 1997 allows some SSI recipients to keep Medicaid after they no longer qualify for cash payment from SSI. So in New York City, if you lose your SSI, you'll receive a Stenson renewal packet in the mail saying you no longer qualify for SSI, but you still can potentially qualify for Medicaid. That Stenson renewal will need to be submitted back to Medicaid. And if you're outside of New York City, you'll want to contact your local Medicaid office for assistance. The Pickle Amendment is if you receive SSI/SSP and lose eligibility because of SSDI cost of living adjustments, but do not qualify for DAC budgeting, you can keep your Medicaid. Next slide, please. The Disabled Adult Child, DAC, is if you lose SSI because you are eligible for SSDI benefits as a DAC, you may be eligible for special Medicaid budgeting. So to qualify for this, you must receive SSI the month before your SSDI payments start. You must have a disability that occurred before the age of 22, must have and maintain less than 2,000 in countable resources. And this allows you to keep Medicaid without a spend down, even if your SSDI benefit is over the Medicaid income limit, including yearly cost of living adjustments. Next slide, please. So now we're going to talk about Medicare overview. So what is Medicare? It's a federal health insurance program for people age 65 and people under 65 who qualify based on disability or certain medical conditions. People under 65 who receive SSDI/DAC benefits can enroll in Medicare after a mandatory 24-month waiting period. And they should enroll in that 24-month waiting period, after that 24-month waiting period. People with certain medical conditions such as end-stage renal disease and ALS can qualify immediately under the Social Security's Compassionate Allowance Program. And people age 65 and over can enroll starting 3 months before their 65th birthday, up to 3 months after that birthday. Next slide, please. If you do not enroll in Medicare during the initial enrollment period, you must wait until the general enrollment period of January 1st through March 31st. People who have group health coverage based on current employment or as a dependent adult child may qualify for a special enrollment period. Next slide. Original Medicare has 3 parts. Part A, which is the hospital, Part B, medical, and Part D, pharmacy. Does not cover long-term care, most dental care, eye exams for glasses, contacts, dentures, hearing aids, and fitting exams, routine foot care, or acupuncture. Medicare Advantage, also known as Medicare Part C, is HMO plans contracted with commercial insurance companies. May cover additional services such as dental and vision, and most people with both Medicaid and Medicare do not need a Medicare Advantage plan. Medicare Supplemental Insurance, Medigap, is plans sold by commercial insurance companies, which cover co-payments and co-insurances. Next slide, please. Medicare overview, the Medicare premiums. So Part A has a 0 premium for most people. Part B has a $164.90 premium for most people. Part D offers 0 premium plans for Medicaid recipients, and Medicare Advantage and Medigap premiums vary by plan. Part B premium penalties may apply if you do not enroll in Medicare during the initial enrollment period. As I was saying earlier, it's important to enroll if you start qualifying for Medicare. The monthly premium increases by 10% for each 12-month period you were eligible for Part B and did not enroll into that program. So it's important to make sure you pay attention so you enroll in Medicare when you're eligible. Medicare always pays for covered services before Medicaid, and Medicare typically pays after commercial group health insurances. Next slide, please. All right, some COVID-19 program modifications and updates. All cases due to expire through December of 2022 and January of 2023 will be renewed automatically for 12 months. So you don't have to worry about recertifications for your December and January cases coming up. If you are in the Medicaid buy-in program, the MBI-WPD program, and lose your job, that grace period has been extended from 6 months to 12 months if you have trouble finding work. And the PHE is currently extended through January 11th, 2023. Program modifications are subject to change at any time as the public health emergency evolves. So just be aware, this is what we know right now. But as we know, everything is constantly changing. So please be aware and alert for updates on anything. Next slide, please. And thank you, families and members, for joining us for this presentation on Medicaid. I hope this helped give you some more understanding on Medicaid and the different programs associated with Medicaid. Thank you very much and have a wonderful winter season. Take care.